Hello, folks. I am the old sergeant. The Wuhan coronavirus pandemic is an economic and health disaster for the world. Here is the recent information I have consolidated from open source intelligence. There's just too much news happening on a minute-by-minute basis to have a good outline of current events. This is just some of the information we have. First, let me go over the current virus's threat factors. It is airborne. It's aerosolized, so you can get it by inhaling it or it hitting your eyes. The incubation period is now up to 27 days. They're still doing the 14-day quarantine periods, which is very ineffective. They just discovered this with the cruise liner, I believe it was Pacific Princess. They've gone back and talked to the people that were released, and now 40 of them have coronavirus, and we expect it to get even longer. Many people are recovering from the virus, but they're still contagious for a long period of time. This is standard for viruses. You could have the flu, get better, but you could still spread the flu. Now, let's discuss the etymology of the word quarantine, which means the word history. In the 1660s, it is the period of time a ship is expected that is carrying the disease to be kept in isolation. It is from the Italian quarantine, which literally means space of 40 days. So called from the Venetian policy, first enforced in 1377, of keeping ships from plague-stricken countries waiting off its port for 40 days to ensure that no latent cases were aboard. We should be doing that. 40 days at least for this virus. It's like the people are not waking up to the reality of what's going on, and they're not waking up to the latest information. They're keeping the standard way of doing things. It is killing people of any age and health range. The primary victims are the elderly, along with smokers, people with diabetes, heart disease, asthma, and 60% of the victims have been men. As I mentioned before, it can be transmitted through the eyes, ocular transmission. The surface transmission right now stands at 9-day survival time for the virus on surfaces. It survives hot, humid climates as well as cold and dry. A lot of people are talking about, well, when summer comes, just like the flu, this will die out too. Don't count on it. The R naught factor, how much you can spread the disease from one person, has gone from 2.3 to some numbers as high as 7.0. They don't know the reality of how much this spreads. Some current reports. The current numbers, as reported by Johns Hopkins, is 81,245 infected with 2,770 deaths. These numbers are way below the reality. Accurate stats on the disease will have to come from outside China, Iran, and even America. China is not really updating its current numbers. The CDC has come out. It's no longer a question of if, but when the coronavirus will spread in the U.S. Centers for Disease Control and Prevention, the CDC officials said on Tuesday, as they told parents to prepare their children for the possibility of school closures. The CDC said Americans may need to prepare for teleschooling should the virus continue to spread throughout the U.S. So far, 57 cases have been confirmed, 14 in the nation, 40 from citizens repatriated from the Diamond Princess cruise ship in Japan, and 3 evacuated from China. It was very, very stupid to bring those people back. And they brought them back on an aircraft filled with people that did not have the coronavirus. They only had something like a taped off tarp. That's going to go real well in recirculated air on an aircraft. You are just condemning everybody to be infected. That's criminally stupid. And I hope there's an investigation to find out who the idiot was who allowed this to happen. Back to the CDC. And although the threat is currently low, the director for the National Center for Immunization and Respiratory Diseases says the public needs to be ready if the virus becomes a pandemic. It's a pandemic. It's not so much of a question of if this will happen in this country anymore, but a question of when this will happen, she told reporters in a media call on Tuesday. We are asking the American public to prepare for the expectation that this might be bad. Now with some bullet points that I found. Low numbers in the U.S. are because they are not testing for the coronavirus. Only approximately 400 have been tested. People are being diagnosed with pneumonia and other diseases, like they did in China. They are not being tested. The World Health Organization decides to remove the word pandemic from their vocabulary. Well, once this disease met all the requirements to be called a pandemic, well, we don't want to scare anybody. It's now politically incorrect to say it's a pandemic. Now, as a matter of fact, now it seems that just talking about the coronavirus means that somehow you're a racist against the Chinese. Amazing. Yeah, you can't have a pandemic if you don't use the word. And everybody knows that we are in a pandemic. Who is just mainly interested in saying great things about how China is handling the situation. Very much in the pocket of China. A woman with coronavirus admits she knowingly had the virus but got on the plane to Omaha anyway. She is responsible for all the people on that aircraft and other places she was at. If anyone dies or is considered, it should be considered second-degree murder with the death penalty. Just because she wanted to get home and she didn't care about the lives of anybody else. Europe is threatened as the disease spreads from Italy. There's also another report that the person they thought was patient zero in Italy turned out to never have had the virus. So now they have no idea how it got into Italy and spread so badly. Brazil confirms the first case in Latin America. Latin America being rather poor, this could be disaster, complete disaster for South America. New case confirmed in the United States brings the number to 60. 7,000 Americans are said to be self-quarantined. Yeah, who is monitoring to be sure that these people are not leaving? And even if they're honest folks, they were probably told for 14 days, when it should be at least 40. A youth soldier in South Korea tests positive as the global toll rises. I was waiting for that to happen. I served in South Korea, so I know how close the bases and the communities are together, and it was real easy to happen. It was just a matter of time with the problems that South Korea is having right now. A Chinese coronavirus patient was reinfected 10 days after leaving the hospital. So the question here is, was he actually reinfected? Like he touched something with coronavirus on it and he got sick again? Or did he get sick again from the virus he already had in his system? In Shenzhen, Hong Kong, after factories resumed work, approximately 14 transmitted cases and over 600 workers needed to be quarantined. So yeah, because of the economic impact to China and other nations, they're desperate to get the factories going again. But all you're doing is exposing more people to getting the virus and making it worse. Turkey and Pakistan have closed their borders with Iran. You can imagine anybody with borders to Iran is going to be closing it. Iran is in terrible shape. They had one of their health leaders, deputy of some health organization. You could see him while he was standing there telling people it's not a big deal, don't worry about it. He's sweating profusely and getting sick in front of everybody, and he's hospitalized now too. We can't trust the numbers coming out of Iran. It may not be malicious. It may just be their government is suddenly overwhelmed with what's going on, and they're doing their best to close religious areas where Muslims congregate for worship. But by doing so, they're spreading the virus all over, and this is going to end up spreading throughout the Middle East. The politicians are underestimating the threat because of WHO's censorship. WHO's worked with a lot of folks like Facebook and Twitter and YouTube to try to censor discussions and reports about the virus. And so that our politicians are not getting the full, clear story of what is going on and how dangerous this all is. This just happened. San Francisco declared state of emergency. Even though they don't have a single case, the state of emergency allows them to put previous plans in operation to get ready for when they start to have cases. And you can imagine with all the homeless people, you've heard about the problems in San Francisco with all those homeless people, that once this takes hold in San Francisco, it's going to be horrible. Now, more of my perspective. We are being lied to about the number of infections in the United States. It is probably to avoid panic as the government tries to get its act together. The president is even downplaying the threat, even though he has called together teams of the best experts we have in country with plans to deal with this. And they're already taking actions across many military bases to set up quarantine areas and just getting everybody ready for when it does happen. The test kits that we initially had and sent out are faulty. And they say it's going to be at least next month before we can even start pushing out test kits. And that's another reason why we're not getting the real numbers as to the infection rate in the United States. And a lot of people flat don't know what's happening. They have this fall under the politics that they don't care about listening to, and they are not seeing this. They just believe, oh, that's just in China, and not realizing that this is a pandemic and it's coming for us. So get ready. I suspect there are infected people all over the United States, and it will be months before the government comes clean with the real numbers in America. Also, we can be sure that there are infected enemy agents purposely spreading the virus as far as possible in our homeland. This is a well-researched method of performing terrorist attacks against our country, is to have infected people come over and spread it before they die. And even if the fatality rate for this virus is as high as the 10% that we are currently seeing in some places, that means that that agent will probably survive their actions. So what action plan is there? The reality is you need to stock up on several months worth of food for a really long quarantine period. If they lock down your city, your town, and you're stuck inside the house, you're going to need as much food as you can get. Order it now. Have it delivered to your house. I just did that. I just ordered a bunch of food, and it was just delivered to my house, so it's in a box in the basement. And in any type of emergency, I will have food around. So you need to do that. Get as much of your medications as far in advance as you can. There are a lot of medications they're only giving out on a month-by-month basis. And you could have problems if you can't get the medication anymore, especially because a lot of our medications come from China. And with all the supply chains breaking down, you got to be prepared for not having vital medication. Stock up on water. If you got containers that can hold water, fill them up. And you can replace it from time to time. Even if you have containers that you don't trust drinking the water after you use the container, it can be used for flushing the toilet. It doesn't hurt to have all these supplies. And you can imagine other necessities like toilet paper. Have plenty of that around. Have at least 40 days to several months worth. At least we'll have a stockpile if nothing happens. I was in a hurricane in the mid-80s and is in Mississippi. A Cat 3 came through, and my house didn't have electricity for 6 weeks. All the food was gone in the grocery stores. It was amazing to go in there and see aisles and aisles of nothing but empty shelves. And I was lucky being military. I was sure that I'd be able to go on base and get fed if necessary. But folks, waiting for the hurricanes that can hit every season, get prepared for it. And they know things like the food's going to spoil because the power's going to go out and be out for a long period of time. So all the food is going to spoil. All the food's spoiled in these grocery stores. I saw right after the hurricane, because the power was out, we had lots of local folks having outside grill to cook up all the food that before it spoiled. And the neighbors just basically had parties eating up all the food before it got spoiled. So you need to get ready. Get the bottled water. Just fill up containers you have. Get a lot of the food. Be ready. Because more likely than not, you're going to be stuck in your house. I am the old sergeant. Stay informed, stay active, stay prepared, stay vigilant.